6 months have passed since my fourth cancer diagnosis. Here is a short timeline and my current situation. March 23, I felt a lump in the right side of my groin area. March 29th, after an ultrasound and CT scan, a biopsy was taken. April 18th, I was diagnosed with squamous cell carcinoma, stage 3, metastasized in the lymph nodes of the groin area. I arranged for a second and third opinion on my situation. The 3 medical opinions and treatment options were more or less aligned. The first step would be the removal of 15 to 40 organs, mostly lymph nodes, in the groin area. Chemo and radiotherapy could be administered after the surgery. All specialists agreed on surgery first. Without the standard of care, which would leave me disabled, destroy my immune system, or even kill me, my chances of survival were estimated at 0, according to the doctors. In the second half of April, I did in-depth research on the disease, the prognosis, and the proposed therapies. After understanding that cancer ferments glucose as a primary energy source, I instantly switched to the ketogenic diet on April 22nd. May was mainly used to research alternative cancer treatments. I have read hundreds of medical publications, clinical trials, books, articles, and testimonials. I spent day and night searching. On May 15th, I assigned my accountant to put my affairs and inheritance in order. We hired the legally required assessors with our family notary. On May 28th, I cancelled my planned surgery of May 30th and informed my medical team that I would no longer pursue the standard of care. After some respectful back and forth with the hospital, we agreed on doing follow-up scans at the beginning of October to monitor the progress of the cancer and metastases. On June 1st, I started metabolic cancer treatment, reinforced with supplements and cancer-killing medications, without the guidance of a doctor and without prescriptions for pharmacy medications. I have not had a doctor's visit since. On September 5th, I had an appointment with the notary to sign for the transfer of my estate. I left all my possessions, company, house, cars, and belongings to my wife and 2 young daughters. On October 5th, I had a full-body CT scan with contrast fluid and a full-body PET scan. On October 12th, I had an ultrasound of the groin area where the initial metastases were discovered and biopsied. On October 12th, 23, at 4 p.m., I had my first consultation with any doctor since I started my 17-week cancer treatment protocol. The team of specialist doctors had reviewed the 3 scans, CT, PET, and ultrasound, and I was declared in complete remission and NED, no evidence of disease. The doctors did not recommend further treatment, but advised CT and PET scans in 4 months.